right. Good morning, everybody. Apologies if the link wasn't working for some of you. Hopefully we'll get everybody in here to get this started. I wanted to kick us off with a couple notes to begin with. I think, Daniela, I see you raising your hand. If you don't mind chatting your message, that would be really helpful. I just want to touch base and do a couple announcements and then turn it over to Dr. David to get this party started. Thank you again, everybody, for joining us. Sorry if you had any trouble finding us. I know we sent out maybe a wrong link at some point. I want everybody to know that we're going to start with everybody on mute, but please message, chat your questions. I can interrupt David at any time. I'll be monitoring the chat. He encourages you to do so. While I'm encouraging you guys to chat, we would love for you to take a moment, let us know where you're signing in from, and what your favorite park is. We would love to see that information. I also want to give you a heads up that the Zoom is going to cut off at 9:35. So apologies in advance that we're limited in our time together. But if you do get cut off at 9:35, that's because the Zoom is over. So let's make the most of this and get as much time as we can with David. I'm going to stop talking. I might have missed something. But again, tell us who you are, where you're coming in from, your favorite park, message that in the chat, and questions along the way, please chat them, and I will interrupt David and tell him we have questions coming in. Did I miss anything, David?
No, that's great.
All right, without further ado, here's the big guy himself.
Oh no, I don't know if I can live up to that. David Sabgir. I'm with my wife, Kristen, and we are walking in New Albany, Ohio, which is a suburb of Columbus. And we're in a great park called Rocky Fork. Little overcast, which is great. It's a beautiful morning. And I'm so grateful that you guys are here. And thanks for putting in where you're coming from and your favorite park, whether it's in your city or another city. I'm really curious. So today I want to talk about what I'll often go through with patients in the office. I go down a list of ABCs, and with everything going on, I've been able to get all the way to Z. And we're not going to do that today just because of our limited time. And I want to answer questions. So I want this to be as interactive as possible. I also apologize. I see the bad words coming down on the bottom of the screen. I'm really sorry about that. I don't know. Looks like we were hacked. But so I want to get as in depth as we can with your questions, because just like we hear in school, if you have a question, someone else, actually a bunch of other people have the same question. So please fire away. And so with it being 2020, let's get right into it. And whatever we don't cover today, I would love to come back and have as many of these until we get all the way through Z and we get all questions answered, because I really feel taking care of your body, taking care of your heart is actually the best way to live. It's invigorating, it's fun, you just feel so much better. And the whole reason Walk with a Doc was started 15 years ago was to get that out there, and I'm so grateful that you're here. Now let's get on with the show. So with it being 2020 and with what the CDC put out this past week in their MMWR, this weekly report, let's talk about anxiety first, because I know there are other doctors on the chat. Dr. Rocha, I know, is here. I'm a big fan, and I would guess he's seeing the same thing in the office. But anxiety with COVID, it's up threefold from where it was a year ago. Depression is up fourfold. So the first thing I want you to know is, if you're feeling that, it's totally normal It's totally okay, and don't feel bad about it. We all feel that. So let's talk about ways that we can combat it. And walking, and this is the easy one, is super good for it. It releases these miraculous chemicals, endorphins, serotonin, epinephrine, that make us feel good and make us feel better. And it's a wonderful elixir against anxiety. And then the other thing that's really important is why I'm so glad that we're all here together is the social connection part of it is huge. Like that's a really big thing. So for us to be walking together, the social connection may be equally as important. Then the other things, the tips that I've really seen work with my patients. Have you guys heard of doom scrolling? Don't do that. We're seeing that a lot, and for those of us, it's easy to get sucked in, but if you can pull yourself away from the doom scrolling, whether it's COVID or the fires or all these horrible things that are going on, if you can pull yourself away, that'll really help. I'm not asking you to like totally disengage, but 15 minutes once or twice a day, much healthier than scrolling through that stuff. And there's other really great things that we can do that are proven to work. Gratitude is huge. I like to start each day with 3 things that I'm really grateful for. And I found personally that helps a lot. This morning I was thinking there was an incredible sunset last night. I didn't see the actual sun, but like the blues and oranges and reds were incredible. I get to walk with my wife in this awesome park this morning, and maybe most importantly, we're trying to pull off our first Zoom call for a walk with the doc, which, I don't see the bad words anymore. So maybe things are going a little better, and it's a lot of fun. So in addition to that stuff with anxiety, and I know I'm a cardiologist, but just seeing it rampant in the office these past few weeks, maybe a couple months. Other things to do, meditation really works, and it doesn't have to be complex. Hopefully no meditation experts are on the call that can correct me, but if you're intimidated by just the word, just watching your breath, being aware of your breath, or sitting without your phone, even if it's for 5 minutes, 2 minutes, 10 minutes, can really, really help with this stuff. Other things that work, journaling, huge. Just writing your thoughts every day, and I'm all for just getting started. So if it's even just writing a sentence or a paragraph, that getting your thoughts down on paper is really good. I have patients with coloring books. That works for a lot of people. So reason I'm kind of hammering on about anxiety is probably the biggest thing I'm seeing, and that can lead to chronic problems. Like there are some hard things that can come of it, but they're rare. And we can talk about that either later today or in another Zoom walk. So that's A. There's another A that we get asked about a lot that's very confusing, aspirin, to get a little more medical. So for a while, until about a year and a half ago, it was pretty widely recommended to take a baby aspirin, which is 81 milligrams for either primary prevention but definitely secondary prevention. So secondary prevention means you've had a heart attack or a stroke and you're taking it, and then you should do that. You should absolutely take an aspirin and talk with your doctor. But a lot of doctors will give a baby aspirin. Some feel stronger about a full aspirin. Personally, I use a baby aspirin. It's probably a good time to say, like, don't do anything based on what I say, because I don't know your chart, but you can use me maybe as like the doctor you tell your doctor about when you see them. You met him at a party and he told you to take a baby aspirin. What do you think? So that's for secondary prevention if you've had a heart attack or a stroke. Primary prevention means you've not had an event and you're just trying to protect yourself. Personally, from the way I see the data, that's not really recommended anymore. So myself, and I'm in a group of a lot of other cardiologists, and we don't do that for primary prevention like we used to. Are there any questions at all on aspirin or anxiety? Okay, cool. Well, let's talk about blood pressure. Blood pressure is, you guys probably know, it's called the silent killer because we don't feel it. But the good news about blood pressure is there's so many things we can do to control it. And what is control? 120/80, I'm sure you guys have heard, and that's very safe. There's some doctors that like it in the 120s/80s only. Some of my partners like 130/85 or lower. Definitely under 140, but guidelines, the best thing would be about 120/80. And there's lots of different ways that we can keep our blood pressure under control. And walking is right up there. So the reason that walking is the miracle drug or regular physical activity is it can do so many things. And so anxiety, as you guys, I'm sure, would guess, chronic anxiety can increase our blood pressure. So walking would lower that anxiety, lower our blood pressure. It also has more direct effects through a lot of those chemicals I talked about that are being released when we're walking. And then walking also, of course, lowers our weight. And I have just, my wife's walking really fast. I'm trying to talk and there's little ridges, so I'm gonna slow down a little, let her go. But there are many ways to, well, personally, as far as weight, I feel like it's a very direct relationship with weight loss and blood pressure drop. So that's always my first approach, is not to try medications unless you have to. Often we do have to right at the start, like someone comes in 174/98, you want to get it lower. I look at medications hopefully as a temporizing measure until we can do the other stuff without medicines that can get our blood pressure down. And there's so many things we can do in addition to walking and weight loss. And while walking is the single best thing we can do for our health, or other physical activity, whatever your favorite flavor is, that's, from what I've read, that's about 10% of weight loss. About 90% of weight loss is due to our intake, what we eat. And walking will lower cancer and 100 other things. And we have a 100 Reasons to Walk PDF. If that's something that interests you, we'd love to share it with you. We can get it to you. But if you can get that weight down, and let's say I have a lot of patients with BMIs that are elevated. You don't need to lose all that weight. Often you can lose 5, 10 pounds and you can start to see a difference. And if someone's on medication, you can start peeling it off. So walking, weight loss, one that comes with excess weight is sleep apnea. That's something that we're seeing can really lower blood pressure if it's identified and treated. So please don't be shy to do that. That's a great way to do it without, and a way to get off medications. So that's a really good one.
Hey, Dr. Sabgir, can I interrupt you for a moment?
Of course,
I have a couple questions that have come in. Is this a good time for that?
anytime.
Okay. First question, is there any harm in using aspirin?
That's a great question. The harm is really low. It's more of gastric irritation, hurting the lining of your stomach, but the percentages we're talking about are really low. So I always like to weigh the pros and cons, risks and benefits, and for you, that may be a good thing.
Thank you. The second question, is there a point at which your blood pressure could be too low, and what point is that, if so?
That's a great question. And the answer I've used before, as long as you can walk, talk, and pee, your blood pressure is okay. So it's really looking for symptoms. My wife, her blood pressure can run 90/60, and hopefully that's not a HIPAA violation. But as long as you can walk, talk, and pee, it's okay. When you start having symptoms, though, that's when you may want to peel off. And I'm sure Dr. Rocha has seen that there's some patients that have run 160, 170 their whole life, and you get them down to 120, 130, and they're tired, groggy, dizzy, lightheaded when they stand up. So hopefully that answers that question. So walking, weight loss, sleep apnea. Another one that is coming more and more. You guys may have seen the study this week on alcohol. I forget who released it. I think it was, I'm not sure, but they cut the recommended, well, we've seen a 23.6% increase since COVID in alcohol use. So it was always what we were taught in med school as far as alcohol. This is back in the dark ages. 1 is better than none, 2 is better than 1, 3 is worse than none. Now things have changed, and alcohol is good for heart health in moderation, but when you look at overall mortality, it's not good. It overall, there's an increase in certain cancers like esophageal, stomach, liver, breast. So they've recommended now for guys 1 alcoholic beverage, which is what it's been for women. The reason it was different is women don't have a certain enzyme in their stomach, so they metabolize it differently. So the reason I bring that up under blood pressure is I've seen a lot of patients where the blood pressure has gone up during COVID with this pretty sharp increase in alcohol intake. And as they've stopped alcohol or lowered, their blood pressure has come down significantly. So just one more thing to think about. I don't want to give off the impression I don't prescribe blood pressure medicines, or also called antihypertensives. I do that all day long. And again, I try and think of them as temporizing measures. There are 3 that are recommended to go to first. They're proven, they're generic, so they're cheap, and the side effects are low. And those are calcium channel blockers. And if you guys have heard of amlodipine or Norvasc, that's a common one. It's usually ones that end in pine, P-I-N-E. Another group are thiazides, and those are like, you may have heard of hydrochlorothiazide. That wasn't it's totally different from hydroxychloroquine, but hydrochlorothiazide is a mild diuretic, works really well to lower blood pressure. And then the other groups are ACE inhibitors, and ARBs. And the ACE inhibitors end in PRIL, like lisinopril, ramipril. And then ARBs are their sister drugs. And they're very similar, although you probably, if you've heard of ACE inhibitors, you've probably heard of cough. And these guys don't make you cough. And those are like losartan, candesartan, Cozar. So those are the three classes that work really well. Often those medicines will drop your blood pressure like on an average 15, 16 millimeters. And a lot of times people come in at 170s, 180. So it's not uncommon to be on more than one. Any other questions on blood pressure? Okay, cool. Let's go on to C. It's 9:23. It's cool. We're on a flat area, which is nice. I'll show you guys. It's really pretty park. C, since we're doing our ABCs in 2020, I think COVID is, or coronavirus is probably the best next one. We're hearing a lot of talk about cardiac involvement. That's why the college football, we're in, I live in Columbus, Ohio, where it's Ohio State football is everything. And the Big Ten, the conference Ohio State's in, canceled. One of the reasons they said was because they were worried about potential long-term heart issues. And that's not unreasonable. I was talking, so Dr. Rocha is also on the call. He has had these wonderful conferences where a bunch of his colleagues from Tufts, dozens of cardiologists got together and talked about this stuff, which is fantastic. And I touched base with Mike earlier this week to get his thoughts on a study that was released at the end of July, so almost 4 weeks ago. And it looked at myocarditis, which is what you guys may have heard of in the news. And that is inflammation of the heart muscle. And it showed, this was 100 people in Germany. It was in the journal JAMA. They looked at asymptomatic, so patients that didn't feel anything, or mildly symptomatic, and for COVID, and they had, I think it was 78% had cardiac involvement, which is certainly scary. There's no question about that. The thing is, we don't know that that's different from the flu or a cold virus. I would expect that there, is going to be some inflammation of the heart. These patients had MRIs, but we don't really know. So what I can tell you anecdotally in the hospital and in the office is I'm not seeing it long-term cardiac issues with COVID, but of course we don't know yet. I won't get into the politics of, canceling sports or whatever, but we don't know the long-term consequences. And that's what that study showed, we'll have to see in time, but my personal take is I think it's probably something we would see with the flu and with colds, and then anecdotally from there, I've been doing this since '03, cardiology. You don't really see, I certainly have a couple patients that have had long-term issues from viral cardiomyopathy. Cardiomyopathy, meaning heart muscle disease, but it's pretty rare. So I would stay optimistic about that. And then, of course, all the things we all hear all day long, because I'm guilty of doom scrolling a little bit at times. I'm talking to myself, but it's wearing the mask, 6 feet, not going out if you're sick. All that stuff is still critically important. Any questions on that stuff?
We do have a question, and this is just a warning that we have a little under 8 minutes left.
Okay.
The question is, what suggestions do you have for screening teenage athletes this year who may have had COVID? And are pre-participation physical guidelines changing?
Yeah. So guidelines are kind of slow to change. If someone is having symptoms, at whatever age after COVID, I would get an echocardiogram, which is an ultrasound of the heart, to get a better look. There are, forever said that. I do want to go back on what I just said as far as recommendations. I've heard some general thoughts, and I attended a lecture on this, but they talked about making sure that you take not going out if you have symptoms, and then waiting at least 2 to 4 weeks once you've had COVID before you start engaging in rigorous physical activity. Does that answer?
Good question. I'm not sure.
Okay, sure. Yeah,
Hopefully it
no,
was,
that's fair.
we'll see if the answer is satisfactory. And then I have another question that came in. Can you talk a little bit about monitoring blood pressure at home and how that has changed with COVID?
Sure. I don't know that it's changed with COVID, but I love monitoring blood pressures at home. You guys have maybe heard of white coat hypertension, where 25% of people that when they see the doctor, their blood pressure is high, but at home it's good. So always good to know what it is at home. Most cuffs are great. I really like Omron. They're not a sponsor of ours, OMRON. They're very reliable. And even arm cuff, I've seen good recordings with wrist cuffs, when patients bring their cuff in to be calibrated. What I have seen, which people don't talk about, is over checking your blood pressure. That can just drive your blood pressure up. So don't check it 8 times a day if you're my patient. I like once changes have been made to the medications to know like where we're landing, but that's really good. As far as with COVID, I don't know how much that it's changed as far as monitoring it. Sorry if I'm missing something there. Anything else with that? Okay, cool. So we did ABC. I would love to do this again at another time, and I don't want to cut short, but if we can make this open mic, maybe on mute, but like if anyone has any questions about other stuff, you can please fire away. I can start. Go ahead.
2 that just came in.
Yeah.
Does salt intake influence blood pressure?
Great question. I should have brought that up. That's what happens when you're in a field like this. You miss stuff. So yes, we like to keep that low. 1500 is pretty strict, but 1500 milligrams is going to be really keep that down. 2300 is another number some doctors use. Some people are more sensitive to salt than others. But yes, salt is definitely a player in this game. What you can see too on the flip side is if you start getting lightheaded, if you're super cautious about that and you start getting lightheaded when you stand up, in Ohio, we've had probably, I'm sure it's the same everywhere, is high heat indexes. And I'm seeing a ton of people in the office that are not drinking enough water and get lightheaded. And if you're lightheaded, you think, you know what, I've had a couple cups of coffee, but probably not enough water. You do want to shoot for, some people say, half your body weight in ounces. So 180-pound person, 90 ounces of water. And during that, I would also snack on pretzels if you're in that kind of situation, where you can do a short, acute, little mini salt bolus to get that blood pressure up. That's on the flip side. But yeah, being aware of salt. The other thing that I hear all day long is I don't add any salt to food. You don't really have to anymore because salt tastes so good. It takes our taste buds about 8 to 12 days to equilibrate. So if you start to get serious about this and lowering your salt intake, it may take like 8, 12 days of food tasting kind of bland. But then our taste buds equilibrate, and things that were normal are going to start to taste salty. So that's a good little fix.
Thank
You
you.
see what
So, sorry.
I was going to say, you see what Rachel has to deal with. You get a yes or no question, and I go off for 4.5 minutes.
Okay, with that, we have 1 minute and 20 seconds left before Zoom is going to cut us off. So apologies if David gets cut off on the next question. Maybe we'll do a couple rapid fire rounds. For those of you who were able to walk while you were listening, thank you. For those of you who were sitting, thank you for being safe and the way that you needed to be. We encourage you all to get out and move when you have a chance today, hopefully before it's 120 degrees like it is out in Nevada. Again, let's do a little rapid fire if you don't mind, David, and if you have anything you want to add, we're at under a minute.
Okay. I'm sorry, what? My attorney wife is saying something about a disclaimer. Feels like it's too late for that. If you walked and watched the Zoom, you've probably already fallen into the proverbial open sewer. So hopefully you won't think poorly of us. But I guess I would close by saying how grateful I am, seriously, for you guys to join on a Saturday morning. And looks like we've had over 4,000 steps. So that's really huge. And I want you guys all to live well and past 100.